Welcome back, everyone, to Thriving Through Perimenopause. I'm your host, Dr. Anna Glazer, a reproductive and integrative psychiatrist, and your guide on this journey to mastering midlife. This is the fifth in our video series of 6, and in this particular video, we're going to focus primarily on sleep and sleep disturbance, a really significant symptom that happens in perimenopause. Just as a review, in the first 2 videos, we focused a lot on discussing all of the different symptoms of perimenopause and really debunked a number of the myths and stereotypes related to perimenopause, and reviewed the science behind the hormones to help us understand the different treatment options. In video 3, we dove into a gold standard treatment option, menopausal hormone therapy, and clarified a lot of misconceptions to make sure that you can have an informed conversation with your doctor about this treatment option. And then in part 4, in video 4, we began to really dive into some really specific, significant symptoms of perimenopause. So in that video, we focused on mood swings and brain fog. And in this video, we're going to talk about sleep. Sleep disturbance is one of the top 2 complaints in perimenopause. And what I want to do in this particular video is share with you a couple of excerpts from a sleep medicine specialist. She and I, Dr. Nishi Bhopal, and I did a webinar series on sleep in perimenopause, and I wanted to share with you some of those really valuable insights. So here is Dr. Bhopal, an integrative psychiatrist and sleep medicine specialist, talking about some of the mechanisms by which sleep is impacted through the menopausal transition.
We're going to talk a little bit about some of the mechanisms of why sleep becomes disturbed in perimenopause. And I just wanted to highlight that Dr. Glazer had mentioned that we need more research and more discussion around perimenopause. And we definitely need more research around sleep in perimenopause. Women are underrepresented anyways when it comes to sleep research. And most of the research that we have in sleep medicine is done on men, and then we extrapolate those results and try to apply them to women. So there's even less research available on this topic of sleep in perimenopause. But let's look at some of the features. Among all of the symptoms of perimenopause that Dr. Glazer had mentioned, sleep disturbances are reported as one of the most bothersome symptoms. And about 40 to 60%, we can go back to the first slide. Yeah, thanks, Hannah. So about 40 to 60% of women going through perimenopause describe sleep disturbances. So tell me in the chat, what do you think is the number one sleep disturbance described by women during perimenopause? What do you think they're complaining of? Just let me know in the chat. Or if you've had personal experiences with sleep and you're comfortable sharing, please feel free to do. Do you think that it's issues with falling asleep, staying asleep? Okay, I'm seeing a whole slurry of answers coming through, so let's take a look. So I'm seeing can't stay asleep, waking up in the middle of the night, interrupted sleep, early awakening, hot flashes, insomnia, waking with anxiety and sweats, middle insomnia, night sweats, middle of the night, wake ups, can't stay asleep, waking up at night. Yeah, absolutely. And I'm seeing more and more answers along those lines. So that is the number one complaint. Nighttime awakenings are the number one complaint related to sleep in women during perimenopause, but there's other sleep issues that women complain of as well. And I'm seeing that reflected in the chat here as well. Sometimes difficulty falling asleep, sometimes difficulty waking up too early, anxiety. So we'll unpack some of these issues as we go along. So I wanted to highlight with this slide that vasomotor symptoms can be a cause of sleep issues during perimenopause, but there's other factors that come into play as well. Hormonal changes, sometimes changes in melatonin can play a role. Dr. Glazer highlighted the role of depression and mood disorders in perimenopause. Those kinds of issues can certainly play a role. And we don't want to forget about other sleep disorders. So we're going to look at those too. And then the psychosocial factors as well that come with this time of life. Okay, next slide, please. Okay, wonderful. This is just highlighting how hormones and sleep change across the lifespan. And I don't think I'm able to, but I just want to draw your attention to that the third box at the top where it says menopausal transition. So this is illustrating the changes in hormones during perimenopause. The red line indicates estrogen, that one there. So you see the fluctuations. The yellow line is progesterone. The dark blue line is LH, and then the light blue line is FSH. And I apologize, it's a little bit hard to see, it's quite small. But in the next row underneath, you'll see changes in sleep that come during this menopausal transition and also post-menopause. So what it says there is an increase in insomnia, an increase in sleep disordered breathing. So that includes things like sleep apnea, obstructive sleep apnea, increased awakenings throughout the night, as we've just identified, a decrease in sleep duration, so the amount of time women are staying asleep, and a decrease in overall sleep quality. The next box down indicates some of the confounders, some of the things that contribute to these in addition to the hormone changes. So we've got vasomotor symptoms, age, stress hormones, and mood disorders represented there. And then in the last row, it's highlighting the hormones that are specifically associated with sleep disruption. And so what it says there is decreased estrogen and decreased progesterone. So let's take a look at the next slide. All right, so when it comes to vasomotor symptoms, so that's an umbrella term that describes hot flashes and sweating, and about 80% of women experience vasomotor symptoms during the menopausal transition. Women who report vasomotor symptoms are also more likely to report poor sleep quality and to struggle with chronic insomnia. But not every woman going through perimenopause and struggling with sleep is complaining of hot flashes or complaining of hot flashes that are contributing to her sleep disturbances. So we really need to be considering other factors that could be interrupting sleep. As we've talked about, the presence of sleep disordered breathing or sleep apnea, mood disturbances, medical conditions, socioeconomic factors. And all of these things can be playing a role, right? So it's not just that there's one cause of perimenopausal sleep issues. We're all individuals. Everybody is different. Everyone has a unique life circumstance, unique biochemistry. And so we really need to be taking a multifactorial view of what is going on with sleep during perimenopause. So let's go to the next slide. Okay, what is the role of progesterone and estrogen on sleep? So this is just very simply illustrated here. Progesterone is soporific. It's sedating. It makes us feel sleepy. It makes us feel relaxed. It has anxiolytic or anti-anxiety properties. In addition to that, it also helps to stimulate breathing in a couple of ways. It works in the central nervous system to activate receptors related to breathing, and it also can have a direct effect on the upper airways and basically act as a bronchodilator. It opens up the airways, which is protective against obstructive sleep apnea. So it's thought that progesterone in the premenopausal years, in younger women and also during pregnancy, it's thought that progesterone is actually protective against sleep apnea. But as we go through menopause, our progesterone levels decrease and we might see more collapse of the airway. And then also we're losing some of those sedative and anxiolytic features as well. There are some studies looking at progesterone as a treatment for mild sleep apnea. Now, when it comes to estrogen, estrogen has pretty complex effects on sleep. So it has a wide range of impacts on sleep overall. One of the things that it does is it's associated with the metabolism of neurotransmitters, neurotransmitters like norepinephrine, serotonin, and acetylcholine, all of which are involved in both sleep and mood regulation. So this could be why we're seeing these sleep disturbances and also changes in mood and the increased risk of depression. Estrogen has been shown to decrease sleep latency, which is the time it takes to fall asleep. It's also been shown to reduce the number of awakenings during the sleep zone. Another impact of estrogen on sleep is related to core body temperature. So estrogen is cooling. It helps to facilitate the reduction of core body temperature that is associated with sleep and sleep onset. So when we have reduced levels of estrogen, that cooling effect is impacted. It's harder for your body to turn down the thermostat and cool itself enough to fall asleep and stay asleep. So we see the reduction in core body temperature, that drop is not as profound as estrogen levels decrease.
Now that you have an understanding of the mechanisms behind sleep disturbance in perimenopause, including the impact of the hormonal changes, what I want to do now is really focus a bit more on treatment tools. So as always, as we discussed in the prior video when we were talking about mood swings and brain fog, one of the really key factors is to treat any underlying conditions that might be taking place. So in this case, we're talking about sleep apnea, which happens a lot more often than you might think. And for folks that visually you might not necessarily suspect have sleep apnea is a lot more common than we think. Restless leg syndrome is something that can happen quite a bit throughout hormonal transitions. For example, it's something that really increases in pregnancy and can also increase in the hormonal transition of perimenopause, as well as dental issues. This is a time when engaging in the specializations of your dentist, perhaps an ENT, to really make sure that you're breathing well can be very helpful. After treating the underlying conditions, that's when some of the sleep-focused treatments can come into play. Menopausal hormone therapy, as I've mentioned in prior videos, is a really important consideration because, as you learned from Dr. Bhopal, one of the reasons for the sleep disturbance is the hormonal change. So if we can treat that underlying root cause, your sleep is going to get better, whether it's because of the hormonal shift, the vasomotor symptoms, the anxiety, all of those things that impact sleep. CBTI, I really want to make mention of here. CBTI stands for Cognitive Behavioral Therapy for Insomnia. It is one of the gold standard treatment tools for sleep disturbances that are due to insomnia, anxiety, a wide variety of mental health impacts. And it's more than just sleep hygiene. So it's more than some of the standard things that we think about, like having a consistent bedtime and reducing social media use. Sleep hygiene is really important, but CBTI is a lot more than that. It uses cognitive and behavioral therapy techniques to help you reduce sleep-related anxiety and reduce your insomnia. And CBTI has the ability to help you and is one of the most successful treatments that we have for sleep challenges, more so than prescribing a wide variety of different sleep aids or taking over-the-counter sleep aids. Those are options, of course, but CBTI has a much better success route than many of these biological supplements and prescriptions do. So I highly encourage CBTI, which can be done with an individual therapist who's trained in it, can be done as part of a group, can be done on your own. There's a lot of different workbooks and apps out there that can help. And the last thing I want to mention is environmental interventions. And this is really key to making sure that you have a good night's rest. When you're really struggling with the fact that your temperature is elevated, or you're actually having vasomotor symptoms, or you're having any of the other perimenopausal symptoms, keeping a cool, quiet, and dark environment where you're sleeping is paramount. And that's actually a lot cooler than you might think. We often think about temperature as, oh, maybe it's 65, 70 is a comfortable place to sleep. No, we want to actually go lower than that. And there's a number of different environmental tools that you can use, whether we're talking about a pad that goes under your sheets to help you stay cool, or many other different kinds of tools out there, certain kinds of cooling pajamas, things that are going to help you stay cool so that you're also not getting up multiple times throughout the experience, throughout the night, to have to change your clothes and change your sheets, and then it disturb your sleep that way. So you definitely want to stay cool. Staying cool also actually helps you get into a deeper state of sleep. It teaches your body to be able to rest in a deeper and more relaxed way. And then keeping your room dark and quiet is also really important. And there's a number of other interventions from an environmental perspective and other tips and tools that I would like to share with you. And again, I'm going to actually refer back to Dr. Bhopal, who's going to share these tips and tools with you directly.
So there's lots of lifestyle and behavioral interventions that we can do in addition to the treatments that Dr. Glazer was just talking about when it comes to sleep, because really we can't force sleep, right? We can't really force it to happen. And what we can do is we can set up the scene to promote good quality sleep, and good quality sleep really starts during the day. So there's three things that I like to look at. And so this is a framework you can use for yourself or for the patients that you're working with, which is what I call the CSH framework. C stands for circadian rhythm, S stands for sleep drive, and H stands for hyperarousal. So we want to address each of these three pillars. So let me explain what that all means. So circadian rhythm is essentially our body clock. Our body clock regulates the sleep-wake cycle, it regulates melatonin and cortisol secretion, and it also impacts hormone regulation. And there have been some studies looking at circadian interventions, including bright light therapy. We'll talk about darkness therapy. This can actually help with some of the hormonal fluctuations, and it does help with, of course, regulating the sleep-wake cycle and improving sleep quality. Okay, so specifically, what we can do for the circadian rhythm is to get bright light during the day, and many of us have a bright light deficiency during the day. Even if you're inside in a brightly lit room, we're not getting enough light intensity, and that can have a negative impact on mood. This is why we use bright light therapy for depression, and it has a negative impact on sleep quality. So going outside and getting bright sunlight for a minimum of 1 to 2 hours a day, if you can aim for that, is ideal. Now, if you're not able to get bright light therapy by going outside, I have a couple of wearables here. There's these light therapy wearables. I don't know if they're charged, but this one gives off some bright light. These can actually be worn, and they are very effective for sleep regulation and for mood disorders. So I might recommend these for depression as well. On the flip side, we want to expose ourselves to darkness. We have a bright light deficiency during the day and then a darkness deficiency at night. Exposure to darkness helps to stimulate our brain to secrete melatonin. And that's the signal that it's time to wind down, to secrete melatonin to reduce that core body temperature. So getting darkness at night, and specifically dimming the lights at least 3 hours before bed, is ideal. That's in a nutshell the circadian, but the other really important piece with circadian regulation is waking up around the same time every single morning. Because oftentimes when we're not sleeping well, the tendency is to try to sleep in on days where you may not have to get up, early for work, or try to spend more time in bed, and that actually throws off that whole sleep architecture that we were looking at. So having a consistent wake time and then also maintaining consistent meal times every day can have a really profound positive impact on sleep-wake cycles. These are the most powerful cues for the circadian rhythm, in addition to light. Dr. Glaser had mentioned nutrition, and so I'll just talk about that briefly. And we can talk about that as well in the context of sleep drive. So sleep drive is our pressure to fall asleep. And so the more pressure we build up or the more hunger we have for sleep, the deeper our sleep is going to be, very simply put. With regard to nutrition, there are studies showing that people eating more high fiber diets that are reduced in sugar and reduced in processed foods can actually have more deep, slow wave restorative sleep. There's also studies showing that this type of a diet, anti-inflammatory diet, high in fiber, can reduce vasomotor symptoms. So it can have an impact both on sleep and some of the symptoms that are disruptive to sleep. It's also good for your microbiome. Eating more fiber helps feed your microbiome, which is also involved in production of neurotransmitters, including serotonin, dopamine, and melatonin. In the interest of time, I won't go through all of these, but I do want to emphasize that if you're trying all of these things, let me just talk quickly about cooling the room, because that's really important too. So you can control the temperature in the bedroom, and a couple of actionable things that I recommend here are to actually open the windows of your bedroom before you go to bed. I do this to cool down the room. There's cooling bed sheets, cooling night clothes that can be used. And it's thought the ideal temperature to fall asleep and maintain sleep is somewhere between 60 to 68 degrees Fahrenheit. But of course, that's going to be different for everybody, depending on your personal comfort levels. And you can even consider, I recommend this to my patients, to consider getting a different bed covering, like a different duvet if you have a bed partner and you have different temperature needs. This is also known in social media as the Scandinavian sleep method. But it's just a really nice, simple, actionable tip to take away. Okay, so if you've tried all of these things, you're spending less time in bed, you're increasing your sleep drive, then don't hesitate to go and talk to a sleep specialist.
As you may have noticed, what I did not include in this list of treatment tools and what Dr. Bhopal did not include are a whole long list of different sleep aids, prescription, and otherwise. Because again, I think it's really important to treat the underlying cause and to address it with things other than sleep medications or supplements, even though those could actually be really helpful. And I use that quite a bit with a number of my patients, oftentimes for temporary relief. So really important to consider these different options with a clinician that you trust and with one who is informed on the different treatment options and treating those underlying root causes. So some key takeaways. Sleep challenges are one of the top 2 most impactful symptoms of perimenopause, and we need to consider the underlying cause. And treatment is going to include menopausal hormone therapy, environmental adjustments, and one of the gold standards for sleep, CBTI. All of those things are really important to get a good night's rest during this transition. Up next, we're going to master the psychology of midlife, including more on CBT, nutrition, the power of community, and whole person health. I'll see you there.